Hello, everyone, and welcome to the Lee Kuan Yew School of Public Policy's 16th anniversary celebrations. My name is Danny Kuan, and I'm Dean of the Lee Kuan Yew School. 2020, what a remarkable year. This is, of course, the year of the coronavirus pandemic. And if that weren't devastating enough already, this pandemic came on the backs of 4 other great disruptions. First, a great power geostrategic rivalry, whose rhetoric threatens to fracture and splinter humanity as much as it threatens the internet and global trade. Second, disaffection across nations as social stagnation sets in the face of rising rich-poor disparities. Many of our fellow citizens all around the world have watched from the sidelines as others among them race on ahead on economic achievement. Third, a growing disdain and a dangerous scorn for science and expertise everywhere in the world. Right now, we're all hoping for a coronavirus vaccine, but we can't forget that in 2019, the World Health Organization identified as one of the top 10 global public health threats the vaccine hesitancy movement, or the anti-vax movement, a group that was threatening to remove their children from vaccination. And of course, deglobalization, as all nations everywhere settle into a comfortable, easy, convenient, but ultimately dangerous retreat into nationalism. We at the school have taken on analyzing these challenges. The school, in its operations this year, has prioritized, of course, in the face of COVID-19, the health and safety of all our community, just as we have continued to treat everyone with equity, fairness, and care. We continue our journey to be a premier school of public policy, continuing to make Singapore a global point of reference, continuing our mission to develop thought leadership, help transform the world for a more sustainable living, to teach the principles of good governance. This mission is as important now in times of adversity as it is in times of comfort and ease. Every year, our anniversary celebrations take different forms. We explore different modalities to bring out key ideas of interest in outreach to the local and international communities. This year, our celebration is a series of webinars building on formats that have come out of our experimenting with what has emerged to be a wonderful success, our Asia Thinker series, that has gone on to attract audiences online of thousands, that has helped develop Asian voices to contribute importantly into the global conversation on local and international challenges. The topic for this afternoon's 16th anniversary celebrations is Singapore's policy challenges. Our faculty group here will take up consideration of the choices that Singaporeans make on pensions and annuities, on housing, on childbearing, and through all this, help bring into focus not just the difficult challenges that everyone faces, but also the challenge of policymaking, communication of unpopular or overlooked ideas, blind spots in decision-making, the challenge of carrying policy from the germ of a good idea to implementation to benefit society. I thank you all for tuning in. Please enjoy and participate actively in our session this afternoon.
Hi everybody, thank you so much for tuning in. My name is Tan Po Lin, and I'm an assistant professor here at the Lee Kuan Yew School of Public Policy. And my research areas are in fertility and educational outcomes in Singapore, two of the pillars that build the future generations of Singapore. So thank you very much for tuning in to our episode. And as spoken, today's webinar is about looking at policy challenges in Singapore. Now, governments often have blind spots when they encounter new thinking and insights from research, especially when it comes to socially sensitive topics. It's not always easy to move the needle. And today is a frank conversation about experiences and insights from this panel. But on our end, researchers may also not fully grasp the difficulties of policy implementation from the lens of policy research. So we will be extending the conversation to cover that as well. Let me move now to introduce everyone to the panel. On my immediate right here is Kok Ho, who is the Senior Research Fellow at the Lee Kuan Yew School and the head of the Case Study Unit, where he leads the Social Inclusion Project, a research program dedicated to analyzing the role of public policies in creating opportunities for participation. Kok Ho received his PhD in social policy from the LSE, London School of Economics and Political Science, where he was a UK Commonwealth Scholar and won the Titmuss Prize. His research now is concerned with retirement income security, minimum income standards, social housing policy, and homelessness. Next, we have Joelle Fong, who is an assistant professor here at the Lee Kuan Yew School. She holds a PhD in applied economics from the Wharton School of the University of Pennsylvania. Her research looks at pension economics and finance, public and private insurance markets, retirement security, and long-term care financing. Last but not least, we have Dr. Ruben Ng, who is trained as a behaviorist scientist here at NUS and Oxford and Yale as a Fulbright scholar. Ruben is an expert in successful aging, preventive health, psychometrics, skills gap, and culture. And as you see, this is a very exhaustive list, and we hope to see if there might be even more that we can add to as we talk and have this conversation today. He's credited with creating innovative techniques to measure societal perceptions and stereotypes and program evaluation. Before we start on the first topic, I would like to note that this is an interactive webinar. So we'd like to invite our viewers to share your thoughts and comments anytime along the way. As the moderator, I'll try to read new comments as we talk, so please excuse any slowness. That being said, I think we are ready now to move on to hearing from the first panelist. Let's start with Kok Ho. Kok Ho, you made headlines last year with your important study on homelessness in Singapore. And you're also the resident expert on economic and social insecurity in Singapore. Can you tell us some of the work that you did last year and some of the new work that you have since then?
Thanks, Pauline. So the past couple of years, my energies have been focused on two fairly large projects. The first one was the minimum income standards study that I did with colleagues from other parts of NUS and NTU. That was a study to find out the budget that elderly households need in Singapore for a basic standard of living. We wanted to do the study because when we observed our policy environment, we noticed there was a lack of standards and benchmarks for assessing people's situations, to set goals for policies, and of course to know how well we are doing. So the way we went about it was to conduct focus groups with members of public. These groups are diverse. We made sure they included people from a broad cross-section of society. And these were also consensual focus groups, meaning that in each of those groups, people had to agree on things. Right? This is to ensure that the results that we produce are meaningful, they are drawn from lived experiences, and they are things that the public recognize and can identify with. So key highlights, a single elderly person we found needs about $1,379 a month for a basic standard of living. The study produced exhaustive lists of things and services based on a definition of basic, right, in Singapore's context, which research participants said must enable a sense of belonging, respect, security, and independence, and also give people choices to participate in social activities and the freedom to engage in one's cultural and religious practices. The second project that I did, which we released last year, was the nationwide homelessness street count that you mentioned. This was a study that had a straightforward goal, right, to find out the size of the homeless population in Singapore, as well as some of the conditions of homelessness. It's of course important to understand the scale and nature of a problem systematically, right, before we can tackle it in terms of policy solutions. So in a way, that was a foundational study and a common practice in many other places, but up to last year, it had not been done here before. There were many practical and technical challenges with counting a mobile and concealed population, right, that often does not want to be found, right. So we took reference from international practices, and in the end, we combined two count strategies. One was that we took about 2 to 3 months to do an observational count in all parts of Singapore that we thought homeless people might be living. And then we used the findings from that first round to select a smaller number of sites for a single night count, right? So we could triangulate the data. The exercise as a whole involved more than 20 NGOs and more than 480 volunteers, every one of them trained. So what we found in Singapore, there are around 1,000 homeless people sleeping rough at any single point in time. They are mainly older men. Homelessness is geographically quite widespread and tends to be persistent, although there are also concentrations in poorer neighborhoods. And we also learned that in Singapore, homelessness is a problem of poverty and of a lack of housing options. So the study also produced several policy recommendations in those directions. So since the completion of those two studies, I've been busy with the setting up of a new research program, which we call the Social Inclusion Project, whose aim is to analyze how public policies can help to create an open, diverse, and inclusive society where people have full opportunities for participation. Right? This research program, hopefully will be able to bring together more studies like the ones I've mentioned, to give them more continuity, to make sure there is sustained attention to issues of social security and inclusion. The Social Inclusion Project, the SIP, of course, its main business is to produce independent and transparent research on overlooked and emerging social problems. We'll focus on empirical work with practical impact. But we're also committed to being an outward-looking research program, meaning that you will engage policymakers, practitioners, researchers, and the public to share findings and generate ideas. As a research program, we believe that ordinary people want to understand their community, right, and have the capacity to use information. So the commitment of this research program is that the research findings will always be accessible in the public domain.
Indeed. There was a lot of public interest and a lot of press coverage from this very important research that you've been doing, Kok Ho. So let me start off with a question from the audience. And the question is from Abhishek Bhatia. And the question is this basic income requirement level among elderly and average across all socioeconomic backgrounds, or does it represent a specific consumption preference group?
Thank you for that question. This is an important methodological issue to flag, because when we talk about a basic need built around that definition that I was just talking about, it is precisely about a basic need across Singapore society. Right? So when we create a budget based on that definition, it is a budget that applies to all. Right? It's not a budget for the wealthy. It's certainly not a budget for the poor. Right? So it is not a subsistence budget. It is not a poverty budget. It is a basic needs budget, right? Which allows people to live in the ways that I have described, with independence and freedom and so on. Which is why, in order to produce this budget, we've had to make sure that the focus groups that create these budgets have people from all economic classes speaking together, discussing, justifying their decisions to put certain things into the budget and to take other things out, and finally to agree on the budget. So yes, this is a budget for all of Singapore society, for all elderly households.
I see. So given that there was so much press coverage and public discussion coming out of that, how much would you say that the conversation has started to move the needle when it comes to policy? And in your view, what are some of the difficulties if you were to look from the lens of, say, MSF or HDB or other bodies when they look at your research and try to draw implications from it?
I think as academics, right, as researchers, one of our concerns is always that we complete a study, we put our findings out there, and then nobody reads it, right? Except for students who have no choice, right? So that's always a concern. So I'm always looking out for feedback. When we released the findings to those two studies, I must say that the public interest was very, very strong, right? There were media features across print media, online media, television, radio. We appeared on, daytime Chinese radio, right? Which to me tells me that we are reaching beyond the usual circles of that consume our research. There have been government and NGO requests, many of them, for talks, for meetings, for consultations. There have been public inquiries from school projects that students initiate on their own, to individual offers of help, and kind of more informal social feedback, right? Like neighbors in lifts striking up a conversation about the research, or a taxi driver, or relatives at family gatherings. So all this to me is very precious feedback. The question about impact is a more interesting and maybe slightly harder one to answer. Since the release of those two research reports, which we made sure were accessible to the public, so they still are, they are freely available on the internet. The minimum income standards findings have been discussed in Parliament, and they were cited in election manifestos in the last general election. The homelessness study has helped to guide the government's service planning, where to site services. It has encouraged volunteerism. Right? So NGOs talk about a surge in volunteer numbers. I think it has helped to raise public awareness about homelessness, and I'm really quite relieved on hindsight that all this was done in time for COVID-19, which we knew caused a surge, almost an explosion in numbers of homeless people, right? Because public spaces suddenly became out of bounds. So I was very glad that we did a study when we did, so that when the circuit breaker hit, people already knew of this issue, and many religious places and other kind-hearted people opened up premises to help homeless people. So I would say there has been movement. And I talk about public engagement a lot because that's the key route, I think, to policy change. Because elected governments make policy decisions in response to public demand. Right? So I think it falls upon us then, as policy researchers who want to see change, to study issues that society is concerned about, to use methods that are empirical, that reflect the diversity of society, and that create opportunities for public participation. And of course, at the end of the research process, it falls upon us to take those extra steps, right, to disseminate our research findings. I think as long as we keep doing that, there is always opportunity to move the needle, as you described.
Let me press you just a little bit more on what we've been talking about. So you mentioned that there have been several initiatives that have been basically sprung from your research. And specifically, you mentioned that in Singapore, there is a lack of benchmarks that have been used to look at poverty, and that's one of the things that came out of the first line of research that you described to us, which is the minimum income standards. So first of all, let me just bring up a question from the audience to make this a very inclusive seminar. So this question is from Babinda Twaliwa. The question is, $1,379 seems low for one person. Does it exclude medical expenses?
So again, a good methodological, technical question. So before I answer it, just to flag that the research report is available online, where we explain these matters quite extensively. But briefly, the budget is a basic budget for people with basic needs, right? That means that we created a vignette, right, to guide the focus group discussions of a person who is able-bodied and is healthy, and is generally healthy. That means that the budget includes things like occasional visits to the GP, and a few visits to the A&E, because even healthy people from time to time need medical attention, but it does not cover the expenses of, say, long-term care. So that is a very good question in that it reminds us, right, that this is a basic budget, right? So if anybody has additional needs or requirements on top of what we describe as the basic vignette, then the budget will only go up, right? It cannot go down. So that's a very important question.
So thanks for that clarification. So I think just bring it round, and this will be the last question that I'll ask you before we talk about some of the other research on the floor, now that you've described what you mean and what your findings regarding minimum income standards, how far are we from moving that towards policy as a means of either measuring poverty or somehow using it to alleviate the conditions that are found in households where it's informally recognized as being below any academically defined standards?
There are many steps, right? So some of this research that I've been involved in the last few years, I mentioned it earlier, I think of them as foundational research. They establish a basic layer of knowledge, just as the homelessness study did. The minimum income standard study, I think, is the first step of what I envision as a very long process in us as a society learning that there are ways to do these things properly, right? There are ways to think about standards, so that when we design policy, so that when we look at how well people are doing, we are doing it rigorously and in an evidence-based manner. It's only the first step. Now that we know how much people need, then there is a next question which the research on its own does not answer, which is, if this is the amount of money that is needed, where should the money come from, right? So when we say where should the money come from, we are reminded that there's a normative element in there, right? There's a question of what to us as a society is a desirable way of financing people's retirements, right? Of course, we don't talk about these issues without any, in a complete vacuum, right? We have some foreknowledge, which is that in our society currently, today, older people's retirement is primarily financed by their adult children, right? By their working age children. This we know demographically, and of course, Pauline, you'll be very familiar with this, is just a factually unsustainable situation, right? So it therefore tells us that just rationally, we need to turn our attention to two things. One is work incomes, and of course the other one is social policy, right? A social safety net. In both of these areas, a lot more work is required. Recent debates about wages continue to I think, occupy our attention. So that is an area that requires a lot of work, right? Wage levels. The other one is where wage levels fall short, then how does the social welfare system step in, right? In a way that ensures that people don't sacrifice their basic needs. Because this is really key, right? If that is the basic level, what happens when people fall short? It means that they go without some of the things that we all need to live a decent life, right? So many more steps to go, but we have already started to move.
Thank you. Thank you very much, Karho, for sharing your research. Let's move on to another subject, which is still related to social well-being and income security. So Joelle, you've recently uncovered some new research on CPF life annuities. Can you explain how your work relates to the lives of ordinary Singaporeans?
Yeah, certainly, Pauline. So my work, unlike homelessness, which could be a bit more relatable to the layperson, my work on longevity risk and life annuity valuation is slightly more technical. So I have here some visuals to help move us along. So we see them pop up on the screen. Thank you. That's great. Okay. So let me begin by sharing the context of pension systems in Asia. Pretty complicated landscape, but broadly we can classify the variety of pension systems into two types: defined benefit and defined contribution. So here we see some countries such as US, Japan, South Korea, they have DB, defined benefit type systems, whereas other countries like Hong Kong, China, and us, Singapore, we have a defined contribution or DC type system. So next slide, please. So my research, part of my research focuses on longevity risk. And longevity risk, many people understand it differently. But in the context of pension economics and finance, how we define longevity risk is the risk of outliving one's life savings. So whether private savings, your pension savings, as long as you outlive these savings, you're exposed to the longevity risk. And certainly, CPF members in Singapore, we have the Central Provident Fund, and we are CPF members. We have been exposed to this risk for the longest time because previously what we had was something called a phased drawdown system. So if you look at the diagram, we had this payout for about 20 years, which lasts us for 20 years, and until our nest egg is exhausted. I think it should be the previous slide, if we could move back one slide. Yeah, all right, great. So if you look at the orange diagram, basically what we have is a payout under phased drawdown that will last us for until 20 years. And then after that, if we live longer than that, we're exposed to longevity risk. What happens is that if you buy a life annuity instead, what we're doing is to focus on the green diagram. It actually, in exchange for this nest egg that you pay the insurer, you get this payout for life, right? So that's the key difference. And the key difference here really is that in DC type systems, such as our CPF here, we are actually exposed to this longevity risk because workers have to bear the risk on our own shoulders, which makes this issue really pertinent in the Singapore context. Next slide, please. So for this specific piece of research, what I did was actually to gather some data on these CPF products, CPF life annuities, which are offered under the CPF Life, which stands for Lifelong Income for the Elderly scheme. So it's actually a mandatory annuitization scheme. And the numbers are actually publicly available on the CPF. So what I did was basically to just gather them. And here in this chart, you can see the payouts, monthly payout, dollar payouts for 3 different types of CPF products. Differentiated by males versus females and for different amounts that you invest in these life annuity products. Next slide, please. So some of you may not know about the CPF Life, and this very basic slide just summarizes the key differences, right? If you have not taken my course, my elective on pensions and retirement policies. Yeah, so this is a very quick slide, just summarizing the differences to get everyone on the same page. So basically what Singapore have under the CPF Life scheme is a mandatory annuitization, whereas most other countries with defined contribution pension systems out there, they opt for a voluntary annuitization scheme. Another key difference is that the CPF Life, the products are offered by the Singapore government under the CPF board. In most other countries with DC schemes and with annuitization, the plan participants actually buy these life annuities from the retail providers or the insurers, commercial insurers. So the question here is, what is the money's worth of these life annuities that we have here in Singapore? What we gather from the literature is that in many other countries, the US, UK, and Australia, the money's worth, which is defined as the ratio of the expected payouts over your lifetime divided by the premium that you invested. So that's really the value of a life annuity to a prospective retiree. It's around 0.8 to 0.9. So the question here that I wanted to find out was how much is it in the Singapore's context in CPF Life. So basically, what we need, a few inputs, as I've shown, annuity payouts and premium, which I've shown in the previous table that we have gathered. We need a term structure of interest rates, and we need survival probabilities, which I promised to show in the next slide, so that you can visualize it, and basically tie it all together using a complicated equation as shown there. Next slide, please. So of interest here to some of us thinking about increasing life expectancies is how we can model this kind of increases in life expectancy and then project them over time into the future. So what I did was to use a stochastic mortality model, which is one variation of, if you're familiar with this demographic and actuarial literature, this is actually a Lee-Carter variation of the model. And what we can do is that when we fit the data, the current data that we have on these males and females death probabilities, we can actually use it to project our death probabilities into the future with 95% confidence intervals. So the line that you see, the solid line, is actually our central projection, and the two dotted lines beside it are the 95% confidence intervals. And with this, then we can run simulations, which you can see on the diagram on the right-hand side. And each of these different colored lines represent a different mortality scenario into the future. So basically, we have 10,000 different mortality scenarios, some simulating a very high longevity risk scenario, and some simulating a very low longevity risk scenario. Next slide, please. And this is my final slide. To spare you all the computations, I'll give you the results here. What we found was that the money's worth for these life annuities actually were just about 1.06, differentiating between males and females, but very, very close. And clearly, one of the key findings in this study is that in many other annuity markets in other countries, annuitants have to give up about 10-20% of their wealth to obtain longevity protection. But here under CPF Life, basically you get back what you invested, right? Because your stream of payouts is about how much you have put in, invested in premiums. So this is what the number 1 point something really shows. And part of the reason could be because we have a mandatory risk pool, which really eliminates the problems and the costs of adverse selection. We also have efficient scheme administration under the CPF board. And another reason I could think of is that our life annuity products, the basic plan, the standard plan, and the escalating plan are pretty well designed, if you ask me, because they do have an embedded death capital guarantee. So these are just some findings I have from the study, and I welcome any questions. Thank you.
Thank you, Joelle. So we just heard, just to establish a line of continuity from between you, from Kwak Ho to you. This seminar is, of course, about communication between research and policy, as well as the general public. Now, with Kwak Ho, we were hearing a story that was being told about how the public received some information and reacted with great interest and the beginnings of steps towards transforming that interest and transforming that knowledge into policy. Now, when we hear about your research, which is looking at a related issue related to income security, especially for the elderly population in Singapore, which is one of our key policy concerns. As you pointed out, your research is more technical, and sometimes CPF may not be popular across all segments of the population, precisely because, as you mentioned, it's a mandatory system. So even if you don't like it, you're still enrolled in it. So my question, I guess, just to keep on the same theme of communication, is how do you think that if you were to be expressing your research and disseminating it, communicating it, how do you think that changes the views of either from the policy side or from the public's perspective?
Yeah, so I think from speaking from the viewpoint of an empirical researcher, I think basically what we need to do is really to work with the policymakers to actually uncover a bit more of such evidence that here you have a great scheme, but not everybody has the technical expertise to value it, but certainly some valuation can be done back end and then communicated to ordinary Singaporeans in the form of visuals. And I think CPF is pretty good at that. They have comics. If you look at their communication materials, they tend to use some comics in the 4 different languages, and they also have online calculators whereby people who are interested, just you and me, ordinary Singaporeans, if we want, we can go find out the information. But certainly, I think I think in terms of communication, that is really something that we need to do more of, especially in this kind of more technical domains, in the form of life annuity valuations or any kind of insurance valuations, because CPF members have a right to know what type of products they are buying into. They need perhaps a bit more information so that they can make a better choice. We have 3 different products out there. Are they all the same in terms of the value to the prospective retiree? So I think these are questions that people may ask. So that's from an empirical perspective. I think from a policy perspective, we saw from this one of my slides that CPF have really opted for a path less traveled. Many other countries are doing the voluntary annuitization scheme, but CPF has made it mandatory, as you have pointed out, Pauline. So I think in terms of, there are some pros and cons clearly to this policy decision. Clearly with this mandatory risk pool, you can eliminate adverse selection, and as you can see from the numerical computations, they have eliminated it, right? Because the numbers are so close to 1 and even slightly exceeding 1. If you had adverse selection, you'll be down to maybe say 0.9, because the 10 cents is paid to the insurer in terms of administrative loads and for the cost of adverse selection. But then there are cons. The cons being that there are only 3 products that you can choose from. You don't have a lot of choice. And if you push the private insurers out of the market, basically you crowd the private insurers out of the market, what you're left with is basically just the 3 products that you can choose from, and you may lose the innovation that these private players can bring to the market.
Thank you. I'm looking down at the list of questions from the audience, and I have a question, a clarification for you, Joelle, from Richard June. So the question says, Prof. Joelle, you mentioned that the options that households can choose in CPF, in the 3 of them compared to other countries, would it be more desirable to have more diverse options in Singapore to get more money worth?
Yeah, so certainly I think there's merit to that point. Some of the types of products that I'm thinking of are, for example, joint life and survival annuities that we see in other countries. So, for example, you buy it as a household, your husband and wife buy the same annuity, and the payout of the annuity depends on the joint survivorship of the husband and the wife. Sometimes they call it widow annuities because women tend to outlive men. But what we have here in the CPF is just individual life annuities. So, for example, if the husband passes away, the wife doesn't get anything from that life annuities. Another type of annuity that I can think of would be variable annuities, and these are linked to investment portfolios. So it gives the annuitant an upside if equity markets do well, your monthly payouts actually increase. But then again, there's the flip side. If your markets are not doing well, then your monthly payouts will take a cut. Yeah.
I guess coming again, looping back to the seminar theme of communication. Just now we were with Coco talking about how when you inform the public, when you get more interest from the public, oftentimes you can use that as part of the push to drive policy. And with you, we were talking about how the public may actually dislike certain aspects of the mandatory life annuity system that we have. So in this direction, from public pushing pushing from the public's perspective to translate that to policy. Now, when we have a population who may be more averse to mandatory participation in such schemes, do you think that we should still have that directional flow of public's reaction translating into policy reactions? Or do you think that actually we should be thinking about it as an empirical scientist, thinking about it from almost from the policy perspective, and then translating that back to the public's perception of the issue?
Right. So I think the policy aspect and the technical aspects actually come together. To push out policy, perhaps you want to actually draw attention to this technical aspect that is fleshed out, that the annuities that you're buying into are pretty good value for money for the ordinary Singaporean based on our life expectancies that we have in Singapore. And so I see it as a kind of reinforcing one another in that sense, rather than just policy and technical. But it's a pity that we don't, spend more time to uncover such evidence, because the Singapore annuity market is a very small market. It doesn't get much research attention from international researchers. But here we have this successful scheme. It's a small scheme, covers 3 million, 4 million of us. But still, it's a scheme that works out. And basically, it's run as a non-profit, because you get back 100% what you have invested in premiums, at least based on my assumptions. And I think what many countries perhaps would want to pay attention to, and policymakers in other countries such as Hong Kong, which is also rapidly aging, and also has a DC type scheme, what they may want to pay attention to is if they were to follow Singapore example in mandating an annuity pool in this longevity insurance scheme, to actually think about the source of risk in terms of this high and low longevity risk scenario, because the previous trends in mortality may not be sustained into the future. So I think whether you're the government offering the annuities or a private insurer offering this, we must pay attention and be able to quantify this source of risk on your portfolio.
Thank you. I can really relate to the tension that we've been talking about when we talk about how empirical work and trying to translate that both to communication, to the public and policy, because in my own research, actually, I come across similar tensions as well. So I guess just to grab the floor and to motivate that with a very quick summary of some of the research that I've been doing recently. I've been studying actually an issue which is also somewhat controversial and where a lot of Singaporeans have strong opinions about, but it's much less technical. What I study is actually the marital sex lives of Singaporeans, and of course it is an issue that demands much less technical knowledge and technical models compared to what Joel has shown. I just want to highlight that in my work, what I find is that because there is actually quite high levels of stress, and I find that is linked to the level of frequency of sexual activity, it actually pushes the time of childbearing forward by quite a bit. So in Singapore, what we have is, on average, couples will have sex, married couples will have sex about 3 times a month. Compare that to another context in actually many other countries. I would just bring up, for example, the United States, where the average is much closer to 6 times a month. Now, what's the difference between 3 times a month and 6 times a month? When we refer back to the biodemography literature, the difference translates to a waiting time to pregnancy from about 8 months if the couple were having sex every 6 times a month, to 15 months waiting time if they were at the current level that we see in Singapore. And as a result, the age of childbearing is actually being pushed up because of the level of sexual activity, which is in turn shown to be linked to the levels of stress that women report feeling in their day-to-day lives. Now, why is this? Might this be a sensitive issue? It certainly might be a fun topic to discuss, but what's controversial about it actually is the idea of older childbearing, and whether or not older childbearing ought to be thought of as something that should be discouraged versus encouraged. As you've already noted, Joel, as researchers, we try to look at the empirical issues. We try to look objectively at numbers as far as we can. When it comes to the topic of age at childbearing, the literature that we would refer to instead of live tables would be looking at medical studies. And medical studies tell us in quite clear terms that as you wait to have children, you're simultaneously less likely to be able to conceive within a short period of time, as well as, and you also face higher health risks, both for mother and for children. So this is a message that, that I think is being addressed in the research that I work on, but I find that both from a public reception of the research, as well as from the policy makers' perception of the issue, that there's a great reluctance to contravene the popular idea that one can have everything. One can have childbearing at the ages that that one prefers, even if that were the late 30s or even early 40s. And I think that comes along with a whole suite of views, really, social perceptions of what constitutes a good life, what constitutes properly meeting your obligations as parents. So in general, there's quite a lot of tiptoeing around certain controversial parts of the story, and making sure that when policies are being formulated, that public sensitivities are being taken into account. So I guess maybe this is a good time for me to move to our resident expert here on policy communications, and who's Ruben, of course. And Ruben, you're the expert in the room on blind spots in policy making and the art of policy communications. Can you tell us what your line of work is all about, And also maybe could we get some of your responses after having heard out the room in terms of how we have tried to move our research towards policy?
Sure. Thank you so much, Pauline, for moderating this session. And thank you to Joelle and Kok Ho for sharing really interesting insights about policies that are critical to Singapore. So good evening again, and a special warm welcome to our 16th anniversary, LKY School 16th anniversary event. Special warm welcome also to our alumni, wherever you are. So good morning, good afternoon, or good evening. My name is Ruben. I'm a psychologist by training, but a very undisciplined psychologist because I've been applying psychology. I had careers in research, government, and private sector before joining the LKY School. So in my generation, this will be scorned upon as job hopping, but in my students' generation, this is known as job sampling. So indeed, what a different world. So like my esteemed colleagues, I think what I try to do is to let, besides getting into publications and things like that, it's really critical to let ideas leap out of publications into practice down the value chain so that it'll make a difference to policy and practice. So in this regard, I work a lot with governments in Singapore and around the world, and I found that one of the key areas, one of the key ways to communicate policy and have that discussion and conversation with them is usually telling stories. So let me share with you, in that light, let me share with you some learning points I've had communicating with policymakers in Singapore and around the world through some stories. The first learning point I have is really that best practices may not be best for you. Because most of the time, as policymakers, we will go around the world to learn about what's the best in Norway, what's the best in Japan, and we start to bring these best practices back. But I think we need to understand that our context and culture is very different, so we cannot bring these practices wholesale. Therefore, best practices may not be best for you. You need to really distill some of the learning points to fit our culture and context. Let me give you 2 examples. So I'm an expert in aging. I mean, not the biological sense, but my area of research is really in aging and ageism, aging policy. So when I first got back to Singapore, we were with a group of students and VWOs wanting to look at the situation of hoarding, right? Hoarding has a fine line between hoarding and a collection, but hoarding is when you have too much clutter, it becomes a health hazard, it becomes a fire hazard. So we wanted to, we brought these best practices from the US, and we wanted to volunteer our time to help older adults clear out their house, those who are designated or they scored very high on the hoarding and cluttering scale. So we realized it was very difficult to get through some of these older adults because they're very unwilling, and we were just wondering why, right? Because it's a free service, we are doing it for them, but they seem to be very resistant. So after a while, we took a more design thinking approach. We sat down with them, we started asking them, try to understand from their perspective, why are they so resistant with external help to clear their homes? Then one of these older uncles we spoke to, I got a sense about what he's thinking about because, he's Taoist, right? So in his home, there are many religious statues like Tua Pek Gong and all kinds of statues. So you cannot clear the houses unless a temple median comes and chant prayers. Then you can remove the Tua Pek Gong statues. These are religious statues. Then you can start to clear the house, right? So this is an example. That last mile implementation is absolutely critical. If you bring programs wholesale, but you don't understand the culture and context, it's not going to work. The other story I have is, we were always trying to help dementia patients, and we were wondering why dementia patients don't flush the toilet. Then we understood it a little bit more after we tried to understand why they don't flush the toilets. Because these are older adults and maybe in their 60s, 70s, or 80s, and they were growing up. The toilets as we have now is, you press the toilet, then you flush it, right? But years ago, when I was a child, the toilets were a pulley system. So dementia patients do not, they remember old things, they can't make new memories. So they, after doing their business, for example, they're looking for the pulley, and they can't find it. That's why they don't flush the toilets. So I think it's really critical to, Singapore wants to be a smart city, wants to be a smart nation. Everything is technology, right? But I think it is critical to understand and adapt different areas of technology to make sure it works. So we don't use technology for the sake of technology, but we think of creative ways to really understand and help the problem. The other lesson I got was, when I was younger, I loved to do volunteering. So I was volunteering in one of Singapore's women and children's hospital. To my surprise, in such a big hospital, there was only one psychologist. So I was shadowing the psychologist, and she had different counseling sessions to urge older women to go for surgery or to go for the best course of treatment that their doctor has recommended. So so the experience really struck me because this psychologist was trained brilliantly. She's a brilliant psychologist. She was trained in Australia or UK and the US, but she cannot speak the dialects that our older adults speak. So that's where I realized that if you can't speak the language of the people you're helping, you're helpless. So I mean that literally and metaphorically as well, that it is really critical to speak the language. So, you know, in Singapore, we come up with all kinds of campaigns, right? But I realized that there's always this group in society whom we can never reach. I call them the chronic know-nothings. They know nothing and it's chronic. My aunt is a great example of this. She's illiterate, she's mentally and physically handicapped, she doesn't have a mobile phone, maybe she only has a landline, right? So when she looks at newspapers, she's only looking at pictures, but she cannot read. So how do you reach them? You can't reach them via mobile phone, you can't reach them via surveys, certainly not a web survey. You need to go to coffee shops and hawker centers to sit down and talk with them. So that's why I admire Kok Ho's work a lot, because that's essentially about using innovative ways to reach people who either don't want to be reached or cannot be reached. Finally, just some thoughts about COVID. I think with the advent of, we have been a very difficult year, as Dean Danny Kuan mentioned this year. I think we need to begin to expand what we mean from a policy perspective about whole of society. Because our whole of society methods have not included, even our whole of society population health approaches did not include migrant health. So I think these are examples of our blind spots that I hope COVID will make us understand and learn in the hope of building a more inclusive policymaking environment so that we can include people that are the weakest or the least, and we start building up that base. So those are my initial thoughts.
Thank you very much, Ruben. Just coming back to the idea of blind spots and overlooked spots, and trying to link it kind of back to what the other speakers have been talking about. So maybe we can be more specific and talk a little bit about homelessness to start with, because that's something that a lot of people have heard about already and may have a lot of questions that they would love to hear your opinion about. So when it comes to homelessness, for example, as a policy blind spot, from either the public perspective or from the public sector perspective, hearing research and knowing that there's been an actual account of homelessness in Singapore, and recognizing that this is knowledge that wasn't covered, that wasn't known before, and hence was overlooked to some extent, was a blind spot. What is the initial response, and what is the, is there an impetus to immediately engage with that from a policy perspective, or how generally do you deal with blind spots? Do you try to think about why there was a blind spot, or do you kind of come from a less critical point of view and think about how that does not change the paradigm that we were working in before?
No, thank you, Pauline, for the question. It's a good but difficult question. So from a topical perspective, I may not be able to answer specifically, so I'll let Kok Ho take that. But I think from a more generic perspective, I think when it comes to blind spots, I think one critical point I'd like to make is that Singapore comes from a position of strength, right? So I think from that position of strength, we see how we can get better. So one of the ways really to think about blind spots in particular is sometimes how we do risk communication, which is another area of my research. Sometimes when we do risk communication, for example, we are very locked into current ways of how we communicate risk. Let me give an example. I take an example from Germany. So years ago, there was a huge flood in Germany. So a lot of newspapers came out to say, oh, this is a 100-year flood. Okay? Then after this 100-year big flood, they tried to convene local committees to do something about it, either to build up the infrastructure, to get people prepared. But nobody wanted to do anything. Why? Because they say, hey, this is a 100-year flood, right? So it's not going to happen for the next 100 years. So why don't we let our children take care of that 30 years later? And the next year, this 100-year flood came. Closer to home in 2013, there was a huge flood in Orchard Road. So one of our senior policymakers came out to say, oh, this is a once in 50-year flood. The next week, Orchard Road got flooded again, right? So the critical thing here is the way we communicate the nature of the flood. A 50-year or 100-year flood, actually from a policy or planning perspective, is a planning perimeter, right? Like we plan for 20-year flood, it's unlikely we plan for 100-year flood because it's too expensive to plan for such an extreme. But the public doesn't understand that. The public takes it very literally, right? If it's a 50-year flood, means it will happen once in 50 years. So I think we need to be very mindful about all these lock-ins. So we need to constantly question our assumptions and whether things work. Because if it doesn't, then we should rethink it. How then do we incorporate this into the process? The World Bank now has a practice that every time we start a project, we would leave a certain budget for evaluation. Maybe that's what we should do as well, right? Singapore and most other countries, we have so many prototypes. We have so many pilot studies. But often we find very few can scale, and we don't know what can scale. And one of the ways to think about it is every time we start a pilot project, considering to set aside 5 to 10% of your budget on evaluation, because unless we evaluate, we don't know what to scale, there'll be too many prototypes and pilot projects.
Thank you very much, Ruben, for addressing that particular issue of blind spot from perspective of design. What about Coco? Do you want to jump in here since it was directly related to what you were talking about? I mean, related to your study.
Maybe another way to think about it, rather than blind spots, is that. And this is something we tell our students all the time, right, in a public policy school, which is that change will be slow and huge structural or systemic change will be even slower. Right? So how do we deal with it? As people who work in the space of understanding policy and trying to encourage improvements in policy, I think we must appeal to our more patient selves, right? We must remember that change takes time. So we talk about how in public policy there are levels of change, right? You can change if you think about policies as instruments, you can change the settings on the instruments, tweak the dial. That's the first level. You can think about changing the instrument itself, right? Swap it out for another instrument. Or you can think about clearing the deck and rethinking what you define as a problem, what is desirable or not in the first place, right? So the higher up you move, so the broader and deeper the change you want to see, the harder it is. So in the time that the homelessness study has been released, I think whereas some 10 years ago, if you said that there was homelessness in Singapore, people would say, are you sure? What homelessness, right? We are now past that point, right? It now makes no sense at all to suggest that there is no homelessness in Singapore or that we have universal home ownership. We do not. So we are past that point. But yet we haven't gone that far. We have gone to the point where we say that, so there is homelessness. What do we do? Right now we're at a point where we say, let's send out volunteers to talk to them. Not a bad first step, and a really important first step, because reaching them, right, and engaging them is itself a huge task, right? And it has taken the generosity and tenacity of many volunteers who contribute their free time so freely in the dead of night, right, to do this work. Hugely important work. But we know that on its own, voluntary outreach services will not solve homelessness. So you have engaged homeless people, you have made friends with them. Then what, right? Homelessness research around the world shows two key findings. To tackle homelessness properly, you need, first of all, good quality housing options through which people can exit homelessness. Otherwise, you have nowhere to go. And second is comprehensive poverty interventions. Okay, so in Singapore, the conversation has not reached that point yet. We are still at the point of thinking, shall we put more volunteers out there, make friends with homeless people, think about how to make our society kinder and more compassionate and understanding. All those are really important, right? But we must keep in mind that still many more steps to go, and we must be patient.
Thank you, both of you, for addressing this idea. I would like to bring in the audience once again. We have a question, I think that is addressed to both you and Joelle, and it's talking about the proposed hikes for MediSave life premiums and how it's going to affect annuities and retirement for the elderly. Actually, let me open it up, I think, and maybe talk, Ruben, if you want to chip in as well, you can, because you are also an expert in this area. So does any of the three of you want to talk about the hike for MediShield life premiums?
Maybe I'll just start off. But I have a disclaimer, I don't study the MediShield Life, so I know less about it than the CPF Life. But if you notice what's happening in the Singapore policy landscape is that we have all these schemes with the life label at the back. So CPF Life, MediShield became MediShield Life, and then we had ElderShield, which became CareShield Life. So everything is for life. So what the policy, really the intention behind this label, beyond just a label, is that the government is trying to give us Singaporeans a peace of mind. It says that we are here for you for life, basically, these schemes. So you have your annuity schemes that pay out until the point of death, and then you have the ElderShield, now called CareShield Life, which gives you long-term care insurance protection for life, and then you have this MediShield Life. And certainly, schemes that pay you for life are going to be a bit more expensive, which is why the premiums are starting to rise, as we can see, because at the end, even though you are in this risk pool, we are all in there to protect one another in the sense because we have different risk profiles, but someone has to pay for it at the end of the day. So if you want this additional peace of mind, at the other end of the day, you have to pay for it. But I think what's happening, as we can see with the CareShield Life, is that the government is getting people to start saving a bit earlier. So instead of paying your premiums starting at age 40 for the CareShield Life, now you start paying the premiums at 30. In that way, you can kind of thin out your premiums during your contribution years, so that the burden annually is not so heavy on everyone. So that's my take on it.
I think we have time for just one last question from the audience, and then we'll wrap up because we're getting close to 6:30. This is a question from James Crabtree, and it's open to the panel. Okay. So what long-term effect is the pandemic likely to have on the size and shape of the state in Singapore? Are we headed towards an era of potentially larger and more active government, as S.M. Tharman previously argued in an event right here at the LKY school? Or are we going to return to something, are we going to return to the status quo pre-pandemic?
Okay, maybe I'll share my thoughts. I wouldn't necessarily frame it this way, whether the government will be sort of bigger or sort of have a larger influence, but I'll sort of think about some of Singapore's aspirations pre-pandemic. So Singapore's aspirations, as from my reading, we were looking at trying to build as many high maximums as possible. So it's a little bit like how our education moved from high averages to high maximums. So we tried to scale everyone up, to meet the basic, so we score very well in exams. Then we thinking about multiple pathways for success, sports, arts. Then we tried to create high maximums. Singapore to date has not produced somebody winning the Nobel Prize, so we're focusing on that. But I think the pandemic has brought us to a point where I think it has broadened the base a little bit more. A lot more people are unemployed, underemployed. Underemployed simply means that you're more qualified for your job, where demand for jobs are strong, but positions are not there. So graduates may end up doing non-graduate jobs, for example. So I think we may need to rethink and sort of recalibrate and rebalance to focusing on high averages again to level up the base, because the base is sort of becoming bigger. The other point I want to make quickly in passing is that, throughout the pandemic, older adults have been sort of positioned as more vulnerable, frail, they have higher mortality risk and things like that. I think it has unfortunate knock-on effects, this sort of ageism. So that's another area of research that I do. And we found that ageism, people who have very negative attitudes about aging, live about 8 years shorter. They have higher risk of heart attacks. And it costs, I think there was a study in the US, ageism effects cost actually over 60 billion in healthcare costs. So I think ageism is one of the isms that's under research. And I think these deserves a lot of attention to make sure that we are not too negatively stereotyping our older adults, such as it's internalized and it impacts mental and physical health. So what then does this mean? I think for journalists and for people writing about this kind of stuff, yes, when we write about aging, it is okay to write about dementia and treatment, but please, if you can, write about something positive. So you balance up the medicalization of aging, which is very negative, with some positive stories. I think over time, these positive stories will build resilience to society, will give us strength, and make our society a better place to be.
Thank you. And I want to, we're coming close to the end of today's webinar. Let me just congratulate my colleagues on their wonderful research, whether it be looking at social issues that are really pertinent to the well-being and were previously overlooked, or there are technical issues that require more empirical analysis, and so that it could be brought out to the public in a certain way in order to forward public well-being, or whether it is about creative thinking when it comes to designing policies that will work instead of policies that simply look good on paper or in theory. I guess maybe we have just a couple of minutes for each of us to make a quick closing statement, and maybe we can start, since we started with Coco first, maybe we can start with you, Ruben, and work backwards.
Sure. I think, the key point I wanted to make is it's important to know our purpose. So I think from both an individual perspective and also from a government perspective. I think back to Prof. James Crabtree's question, I needed some time to think. So I think there might be, it's really critical now that the government reevaluates the purpose of a lot of things that we are doing. Because of the onset of COVID and we are in the middle of this raging pandemic, I think a lot of things will change. So we need to rethink our purpose and make government, and government and governance as a whole as purposeful as possible, so that we help solve current problems, but we also build resilience for the future.
Yeah, so my one statement is that some of the work and in terms of policy design and setting up some of these schemes which can benefit Singaporeans in the past tends to be a bit more prescriptive. Maybe going forward, policy can look to be a bit more bottom-up. So just on the issue of, say, pensions and understanding the kind of pension retirement products that CPF offers, one approach to this would be to strengthen the financial literacy of the average Singaporean, and this can be feasibly done. We do have the Skills Future, and some of our retirees are quite mentally alert and ready to learn about the kind of annuities they are buying into. So I think there's room for a lot more financial education and financial literacy for older adults.
And that leaves us with Coco's.
I too, like Ruben, I think James's question is a good one to ponder on as we close today's session, which is whether the size of government in Singapore will change permanently as a result of COVID. It's always important to distinguish between how interventionist a government is versus how much it's spending, right? So when you talk about size of government, it could be the size of its influence. And Singapore's government is certainly very interventionist, right? It does a lot of things, but not all the things that a government does involve spending money. So the government can make laws, can impose regulations, and it can insist on not spending, for example, right? So the Singapore government has been interventionist, but the welfare state we have is very, very lean by international standards. Will these things change because of COVID-19? I think because of COVID-19, we should expect to see more intervention, some of it very much needed, right? But there are as yet no signs that the shape of our social policy, the architecture of our welfare state will undergo more permanent kind of recasting, right? As yet, no such signs. So back to this, the idea of where does change begin, right? So we would think that a crisis naturally gives rise to change, right? But in order for policy to change, there must be ideas that have been in waiting, right? That have been debated, understood by the public, won some support, so that when the old set of ideas kind of outlive their usefulness, the new one can smoothly take its place. We haven't really had that kind of environment, right? Where good ideas have been thoroughly given an airing and are waiting to take their place. So in this regard, I think the university and public policy researchers have a very important role to play. Right? By continuing to do work that matters to society, that is connected to people's lives, and that we send out to the public all the time, right, in the interest of public debate. I think we can help to promote that environment, that whenever an old set of ideas dies, a new set is waiting to take its place.
And that dovetails perfectly, I think, to the beginning of the seminar when our Dean, Prof. Danny Kuan, was talking about this being a way for us to celebrate the school's anniversary. And this is not the end. This is only the first episode of 4 episodes that we'll bring together in order to discuss challenges and implications for governance for the future. So please join us again next week, same time, on the 10th of November, Thursday at 5:15. We are going to be discussing the governance of disruptive technologies. Thank you again, everybody, for tuning in to listen to today's webinar. Thank you very much and have a great evening.